Hi friends, welcome to the Blueprint Nursing YouTube channel. My name's Abby and today we will be reviewing nasogastric tubes. At the end of the review, we'll move on to a practice question to make sure you have a good grasp of the topic. This practice question will be similar to one you will see on your NCLEX Next Generation exam. Let's get started. Let's start with the basics. What is a nasogastric tube? A nasogastric, or NG tube, is a device typically made of flexible silicone rubber. It is a tube that is inserted into the nose, down the throat, and into the stomach. Now that we know what an NG is, let's review what it does. NG tubes have several indications for use. Can you think of what a few of those might be? Feeding, medication administration, and gastric decompression. You got it. NG tubes are commonly used to provide nutrition and hydration to clients who are unable to eat or drink orally. Medications are administered through the tube directly into the stomach. This is essential for clients who cannot take medications orally or need precise dosing. Last but not least is gastric decompression. This is used in instances of gastric obstruction, ileus, or excessive gastric secretions. Most NGs are placed at the bedside while the client is awake, so make sure to explain the procedure to the client prior to insertion. Begin by placing the client in an upright position and assessing the nares to determine which is most patent. Then, using the NG tube, measure from the nose to the ear to the sternum. The NG tube will be marked with numbers for measurement. The number that you see at the sternum is where you will stop when inserting the NG tube. This number will be visible right outside of the client's nose when securing the tube to the client's nose after insertion. The most important thing to remember after an NG tube insertion is to confirm proper placement of the NG tube before use. Check your hospital's NG tube policy because some facilities require pH test strips to verify placement, while others require an X-ray. The gold standard that the NCLEX uses is a chest X-ray to verify placement. Once placement is confirmed, be sure to flush your tube and then you're ready to use it. Complications that can arise during placement include irritation or injury to the nasal mucosa. This can result in discomfort, nosebleeds, or epistaxis, and in severe cases, nasal septal perforation. The most concerning complication is aspiration, which would occur if the NG tube was used after being accidentally misplaced into the lungs instead of the stomach. Again, this is why it is essential to verify placement before use. The last complication that can arise is the NG tube becoming dislodged. This can happen accidentally if it isn't secured properly or if the client removes it themselves. Speaking as a prior NICU nurse, babies removed their NGs constantly. So be sure the NG tube is at the correct measurement before using it. When the tube is removed, this inadvertently delays and interrupts administration of feeding, medication administration, and gastric decompression, which can all result in complications for the client if it isn't caught and resolved quickly. All right, now that we've covered nasogastric tubes, let's run through a practice question. The registered nurse is assessing a client who recently had a nasogastric tube placed. Which of the following signs would raise concern for a possible complication? 1. Complaints of mild nasal discomfort. 2. Decreased respiratory rate. 3. Increased bowel sounds. Or 4. Persistent cough and respiratory distress. Take a moment to pause the video, think about your answer choice, and when you're ready, press play and we'll review together. Ready? So one answer choice that had a red flag for me was option 4, persistent cough and respiratory distress. But why? Well, both of those make my alarm bells go off for concern that this tube may be in their lungs since this client is having a change in their breathing. Great job, friends. Let's run through the other options real quick. Complaints of mild nasal discomfort can be a normal finding. I know I personally wouldn't find a tube in my nose the most comfortable thing. A decreased respiratory rate can be concerning, but we don't have any background information on this. Was their respiratory rate previously fast and has decreased to baseline or a normal range for this client? If the client were experiencing a complication related to their NG tube, we would actually expect to see their respiratory rate increase as their body becomes stressed. And last, an increase in bowel sounds. This would not typically indicate a complication related to NG tube placement. It may suggest normal gastrointestinal functioning. So with that, our correct answer is Number 4, a persistent cough and respiratory distress. Here are our references. As always, thank you so much for coming to review this topic with me. Remember to subscribe to our channel to stay up to date on all of our content review videos. Also check out Blueprint Nursing's self-paced crash course and live study group options. See you next time.